so much. I'll just add my welcome to Sabias, to everyone looking and listening today. And of course, in the future, this will be recorded and we'll get, I guess, we hope anyway, many hundreds more watching this particular agenda, our event that we're recording and talking about today, on really the update and the future of addressing antimicrobial resistance in the Western Pacific Pharmacy region. Now, this is our agenda. We're going to talk a little bit about the progress of the roadmap, what we're looking forward to doing, and Fiona's going to talk about that. Then we're going to have a panel discussion. We've got 3 great case studies. Leonie, whom you've already met, is going to present the first one of those. But what I would ask all of you who are listening and looking is that whilst you're looking at these panel discussions, or rather the case studies, get your questions in the chat box or the Q&A, because after we've had these presentations, we will have some time, maybe 15, 20 minutes or perhaps more, to discuss them and answer your questions. We want your questions and we want your discussion points. So please think about that whilst the case studies are underway. So what are our objectives? Well, here they are. We want to highlight the leadership role of pharmacists in antimicrobial stewardship. You are the leaders. You are the leaders in our region, and we want to highlight your role, and we want to make sure you're in a position to develop that role to the very, very best of your ability, with the support that FIP gives, and of course, your national associations. We want to drive behaviour change and commitment to antimicrobial resistance initiatives through this 3-year AMR roadmap. So we're hoping that the initiatives you hear about tonight, you or today, wherever you are in the Western Pacific region, you'll be able to put in practice in your area, in your country, in your region. And of course, it's all about sharing the learnings and the best practice from across the region to inform future initiatives. So with those few words, I'm going to ask Fiona to take over and talk about the roadmap for AMR Action. It's over to you, Fiona.
Thank you, John. So together with Sabiha, Debbie Goff and Chinyan Yeo, we were looking at the roadmap for antimicrobial resistant action in specifically the Western Pacific region, and members and pharmacists identified what are the key priorities for our region. And for us, they are to establish formal antimicrobial stewardship training at the undergraduate level in all pharmacy schools, then followed by regular and up-to-date postgraduate education in AMR to be provided by professional organisations, and lastly, to access to resource materials to enable trained community pharmacy staff to communicate AMR messages to patients or health consumers. And we're focusing on doing this by, firstly, with the undergraduate training, engaging the universities and training educators of our pharmacy students throughout the region. And we have got the contact details and actively will be asking what formal training is provided and supporting and linking in with other countries or regions which have training that may help if it does not currently exist. Secondly, with regards to professional organisations, also reaching out to those both mainly FIP members, but also the key players in the region to assess and implement regular and up-to-date education for qualified pharmacists. And lastly, and you'll see some of this in the case studies tonight, really the next step. So antimicrobial stewardship and AMR action in the hospitals can be well established, but then now how do we get that message out to the community pharmacy staff? And I'm excited to share with you that, you know, we will see some of the work done in our region in the following case studies. So if there's any way that you feel that you could contribute to our roadmap or really making this happen on the ground, we would love to hear from you or network with you and connect with you. So please get in touch afterwards. And so without further ado, we'll start the case studies. And it's my great pleasure, Sabiha introduce Leonie. She was very humble in her introduction, and she asked me to introduce her as the pharmacist, Leonila Ocampo from the Philippines, to discuss with us the wonderful work she's been doing in the Philippines. Thank you, Leonie.
Thank you very much, Fiona. So I would just like to share my screen. I cannot do it now. I'm not given the option yet. So good afternoon, everyone. Good evening and good morning as well, because we are in the different parts of the world, of the region. So in behalf of the Philippine Pharmacists Association, I am very happy to share what we are doing here in the country to address EMR. The case study that I would present starts actually with a problem, a very rampant problem and very worrisome to every single pharmacist, especially, and health professionals. The problem was the so much misuse, abuse, irrational and irresponsible use of antimicrobial. This started some few years back. And this is an observation that really worries us so much as pharmacists in charge of the different pharmaceutical preparations, most especially antimicrobial. So with this as a problem bombarding us as practitioners, we grouped together and thought of what we can do as pharmacists to resolve such a problem. So we said we need to initiate some change. And as we were thinking about this, you and I know that initiating and introducing change is one thing, while sustaining it would be another thing. So we said, let's not just waste time to introduce change and then later on, it would not be sustained. And for this to be able to happen, sustainability to occur, we said we need to have a legal framework of whatever we would introduce as a change relative to the use of antimicrobial. So a study was conducted as to what the extent of the EMR problem is in the country. And after the study was done, the result was gathered and analyzed, and we planned and prepared a working paper because we wanted to see policymakers and other people who have the influence to support us with the change that we have in mind. After the paper was very well prepared, we started to lobby for a directive on how the use of antimicrobial should be appropriately done. And this was done actually to the office of the president itself. And we did also lobbying with local government units. So fortunately, after a lot of hurdles in the process, we were able to get an executive order or administrative order numbered 42 series of 2014 that created the Interagency Committee for the formulation and implementation of a national plan to combat antimicrobial resistance in the Philippines. And this was issued by the late President Benigno Aquino. So when this happened, a team of health professionals, doctors, dentists, pharmacists, nurses, and others who are involved in the use of medicine was commissioned by the Department of Health to develop national guidelines in prescribing, dispensing, and use of antimicrobials. So with this, we were able to have published a national antibiotic guidelines, and this was actually published in 2018. And then following the publication of the national antibiotic guidelines is a group of pharmacists who was commissioned also by the Department of Health to develop a document or a manual for antimicrobial stewardship program in primary health care. We call it the Manual of Procedures. So we did all of this in collaboration with everyone who has the interest to really protect and keep safe everyone who would be using antimicrobials, may they be health professionals and even patient groups coming in to join with us. And sorry, I cannot move my slides. Oh boy. Okay. I can't move my slide. Okay. So we were the Philippine Pharmacists Association, which is the national organization of pharmacists in the country, composed of about more than 32,000 individual members of pharmacists, brought in antimicrobial stewardship as one of its advocacy, of its major advocacy. And PPHA did strategic planning, how we could do effectively fight antimicrobial resistance. So in the process, a decision was made that the Philippine Society of Hospital Pharmacists will be designated one affiliate organization of PPHA, the national organization, was designated to be the one working with the Department of Health for the training of the hospital staff and support hospitals in the setup of antimicrobial stewardship program. And this particular initiative was in parallel worked for by a team to make EMS program a requirement for accrediting hospital by the national insurance company of the government or of the country. And then the continuing professional development committee of the national organization, Philippine Pharmacists Association, developed a training program for community pharmacists and pharmacy operators. I would like to make mention at this point that in the Philippines, we have pharmacy operators who are non-pharmacists who simply employ a pharmacist as they apply for a license to operate. And we feel they have to be one major target in the training that we will do. So as a result, the Philippine Society of Hospital Pharmacists and the Department of Health forged a contract to train hospitals and help them set up antimicrobial stewardship program. And the Philippine Pharmacists Association, continuing for professional education program or pharmacists, continuing professional education program for pharmacists was run or given to the 88 chapters of the association throughout the country. We did a roadshow or a caravan on AMR to raise awareness and educate the public on antimicrobial resistance as a threat and as a global concern. So this became part of the medication safety program we had. And as a part, it is one major initiative or activity that we talk in. Now, today, hospitals who used not to have antimicrobial stewardship program have seen the importance of it and had established such program so that they could renew their accreditation with the government's National Insurance Corporation. Then training modules for both the hospital group and community pharmacist group are now in place, which we are continuously giving. We also have a training program for patients as requested by patient organizations for them to better understand what exactly is antimicrobial resistance. We do this to the different communities assigned or done by the different chapters that we have of the national organization. So we wanted our clients to understand why they cannot buy antimicrobials without a prescription. Reason is because we were able to successfully also convince local government units to issue ordinances that prevents a pharmacy or any licensed facility in that manner that sells antimicrobials not to sell it without a prescription. And a directive also came out from the Food and Drug Administration and from the Board of Pharmacy Professional Regulation Commission. So these are the things that we actually were doing. Next slide, please. Okay, so the things that we would do moving forward, the next steps is to expand our training of pharmacists in different areas of practice, to come up with a specific program for each group of pharmacists in the different areas of practice that would all be anchored on the main objective of the country plan that we have to fight against antimicrobial resistance. So we are positive and we are hopeful that there will be more who would understand the risk that the patient would be facing when irrationally and irresponsibly use antimicrobials. So this is a work in progress. This is a thing that we have to continuously do, and this is taken care of now. Major activity of this is taken care of by our young pharmacist group already. So we are happy that the younger group of pharmacists are very, very much concerned on this problem. So thank you very much. And this is what we are doing now in the Philippines relative to antimicrobial stewardship. Next slide.
Thank you. Sorry, I thought you'd finished up there, Leonie.
Yeah, thank you. I think I only have my slide as the last, which is a message I would leave to our fellow pharmacists of them to really be playing very important role as antimicrobial stewards. Because if we don't do it now, then we might not have any to use tomorrow. So thank you very much.
Thank you, Leonie. Thank you indeed. And that's quite an effort you've managed over a couple of years now. So that's fantastic. Look, it's very much my pleasure now to move on to our next case study. And that's going to be presented by Judith Nui from Papua New Guinea. I'll just give you a little bit of brief information about Judith. She's had experience in pharmacy practice, in public health, regulatory affairs, and pharmaceutical analysis. She's now based in Port Moresby, excuse me, as quality assurance lead at the Medicines Quality Control Laboratory regulatory branch of the National Department of Health there. And she's a member of the Antimicrobial Secretariat, has been since 2016, and she's coordinated and organised the first Papua New Guinea AMR Forum. Currently, she's a fellow under the Human Health Advisory Fellowship with the Fleming Fund. So welcome, Judith, and let's hear your case study. Thank you.
Thank you, John, for the warm welcome. Good afternoon and a belated happy World Antibiotic to present a case study from Papua New Guinea to you all. Before I go into the actual case study, I just like to share address the journey of Papua New Guinea, how we've come about by addressing AMR in Papua New Guinea. And for those who do not know where Papua New Guinea is just north of Australia. It's in Highland. So in PNG, we have started addressing AMR from the national level in 2016, just recently. So in 2016, we had a country situation analysis, which was conducted by WHO, collaboration with our key stakeholders like the human health and the environment health and animal health. So a collaboration between these stakeholders, it was held in 2016. In 2017, we actually had the National Action Plan developed. 2018, it was unveiled to the there was political commitment, and to the collaborators, the NAP was, National Action Plan was unveiled. 2019, we had our first AMR forum. It was a successful one. We managed to have political influence, and all the policymakers attended, as well as some hospital staff and pharmacists, doctors from the hospitals. And in 2020, we are fortunate to have the Fleming Fund country grant on the ground, and as well as the fellowship scheme involvement. So that has been the journey of AMR in PNG so far. And as you can see, before 2016, there was nothing happening on AMR in PNG. So starting 2016 till now, so far it has been just 5 years, over a period of 5 years, that has been our journey on AMR in PNG. Just the background before I share my case study. So basically, this case study is all about what I am doing as a fellow and as an AMR champion. And I am fortunate to be part of this AMR and working at the Department of Health, being able to address it from the national level to the sites like the hospital and the sentinel site. So what I did all this year, I was involved with AMR in the past few years, mostly with the antibiotic awareness week, but with my fellowship and all that, I was able to do more. So what I did this year, we noticed that there was a need for awareness in PNG, and especially in the health, with the healthcare professionals. So we had to start with the healthcare professionals and then go to the public. So that was the need. So what I did, I visited and did a presentation, educational presentation on AMR from the global perspective and also the national perspective. So from the global perspective, I presented on what is happening in the world and the need to address AMR. And from the national perspective, I shared to them the PNG AMR National Action Plan, the 2019 to 2023, which most of the health care professionals did not know about the National Action Plan. So that was like an awareness to them. So during the time when I told them about, did the presentation, most of them were interested. And what I did, I was able to recruit champions. After recruiting the champions from these regional sites, I came back and was able to do a Gmail group and Facebook group. So what I call now the PNG AMR Network. So from that also, we were able to initiate the PNG AMR monthly webinar. So that is an involvement from both the public and the private sectors, as well as the human the animal team. So currently now, since June this year, we are doing monthly presentations, and mostly we invite the experts on AMR to do presentation on selected topics based on the needs of those from the hospitals and private and public sectors. Both they tell us the needs, and we invite the experts to do presentations. And whatever recommendations and findings that we collect from the webinar, that findings are shared during the AMR Human Health Technical Working Group meetings, which happen every monthly. So we are able to share that as well to them. So we have also noticed that there have been increase in participation, because we share the notices on Facebook, WhatsApp, Gmail, we send it out. So we were able to see more participants from doctors, pharmacists, lab scientists, and pharmacists, both from the community and as well as the private regulatory and supply chain pharmacists as well. So we were able to see a lot of participants joining us over the course of time. So mostly like in a month, for the end of the month, we started off with just having 20 participants, and now we've reached, just last month, we've reached around 20 already. So that's a good progress so far. So the impact we've seen is that I venue for all health professionals to share experience and issues on AMR, and that way we increase the awareness of AMR issues. And one of the things that I saw there is a lot of impact was that the hospital pharmacists were very keen to learn about AMS. They had no idea what AMS was. So during this awareness, they were able to know what AMS program is, and they're keen to advocate in their hospitals and take that up, because they acknowledge that AMR is an issue in their hospital as well. And for the community pharmacists, we are yet to have a law that restricts them to describe antibiotics without prescription. We actually have them, but it's not enforced or it's not strengthened. But now the hospital pharmacists have pledged to dispense antibiotics with prescription or upon prescription. So that has been an impact so far we've noticed. So just to finish off, we've noticed that for PNG, it has been just 5 years of just advocating on AMR. So we've noticed that education is a basic activity to organize towards creating an impact. So before we create any change, we need to make sure that the collaborators and the target groups are well educated. So that's what I am doing as an AMR champion. It's a voluntary job that I do because I'm passionate about AMR. So what I'm doing now is just to advocate to the collaborators and the target group, especially the pharmacists and the doctors, to see that AMR is a problem and is a global issue, and they have to be champions of it and advocate in whatever areas that they could in their areas of practice. So that's basically what I, as a fellow and as a AMR champion, doing in my country. That's all, and thank you for listening. I'm happy to take any questions.
Thank you very much, Judith. Well, we will take questions, but we'll hear from Lisa first. But we do encourage you, all of you, if you've got some questions, please get them into the Q&A box there. We really, really want to know what you're thinking or what you're asking about what's happening in the region. So whether it's for a specific presenter or just a general question, we really want to hear those questions. Now, our final case study comes from Lisa Harris. Lisa is an infectious disease antimicrobial stewardship pharmacist, clinical pharmacist, and she's got extensive background experience in AMS in the New South Wales Health Department in Australia. She's also worked on international AMS projects, including an AMS pharmacist mentor in Timor-Leste, which is not too far away from PNG, I might say. Lisa's most recent position is as a clinical research consultant with a procurement agency specialising in supply chain management to low and middle income countries. And she's written several publications on antimicrobial use in these particular settings. Lisa, it's over to you.
Thank you so much. Unfortunately, we have a bit of a thunderstorm here, so if you can't hear me, let me know and I will change over to putting some headphones on. I will just share my screen so that you have that. So sorry, I can't share my screen while another participant is sharing. So if I could just... I'm hoping that you can see that. So I'm going to present today on community use of antibiotics, because as Fiona said, community use of antimicrobials in primary care is emerging as a priority area in Australia and also in the Western Pacific region. Using for data for action is well established in Australia. However, the current process used in other settings such as acute care can be taken into that primary care setting. You always need good governance, restrictive measures, auditing with feedback that leads to quality improvement projects, as well as education and training around AMS. The commission that I'm currently working for at the moment, which is the Australian Commission on Safety and Quality in Healthcare, achieves these elements through a range of resources and publications. And in this talk, I would like to go through some of the key resources that the Commission develops and supports to ensure that Australia is meeting its commitments to using antimicrobials appropriately, but also supporting the global initiative to reduce the spread of antimicrobial resistance, because that's really what we're here for today, is that knowing that antimicrobial resistance is occurring, we know that the overuse and inappropriate use of antibiotics is driving that. And what we want to do is we really want to use data for action so that we can limit that. So the key resources that I will go through briefly. Right. So the key resources, that I will go through briefly is the AURA report, which is the first publication that was done in 1916, and it's now up to its 4th publication. I'd also like to talk about the Antimicrobial Stewardship in Australian healthcare. It's known as the AMS book. And then I want to talk about the National Safety and Quality Health Service Standards, where there are a number of actions in these publications in both the preventing and controlling infection standards and the primary and community healthcare standards. And these are specific to AMS. And then I would also like to mention the AMS clinical care standards that supports AMS in Australia. So understanding the scope of the problem in Australia comes from a range of sources that go into the AURA report. For example, we have the Pharmaceutical Benefit Scheme in Australia, which subsidises a range of essential medicines, and it provides data for the Australian statistics on medicines and estimates community use of prescription medicine in Australia. We also have something called Medicine Insight on the other hand, and that allows GPs to reflect on their own patterns of prescribing and patient care and to compare these with other GPs in their practice. These can then be benchmarked at a local, regional, and national level if they give consent to do so. The National Prescribing Survey in Australia has a number of modules for different healthcare settings. And we have something called the GP NAPS, which is the latest module, but it is still in its pilot form. However, its rollout to GP practitioners, it's hoped, will provide data that can support quality improvements in general practice. There are also a number of groups that provide surveillance on priority human pathogens and antimicrobial resistance in Australia, such as the CAR Alert and the Australian Passive AMR Surveillance Program. The AURA report puts together the information from participating groups on antimicrobial consumption, appropriateness, and resistance, and it publishes the data regularly to inform priority areas for action. The Commission uses this information to provide information to consumers of antimicrobials and to health professionals prescribing, administering, or dispensing antimicrobials. These publications are updated regularly to support AMS in the community and in the acute care setting. Publications such as the National Safety and Quality in Health Service Standards and the Clinical Care Standards provide statements and actions that health professionals can use to prescribe and use antimicrobials appropriately. So I just want to briefly go through the AURA Report 2021, which is the latest publication. It's the fourth Australian report on antimicrobial use and resistance in human health. And I think that's really important because it marries the antimicrobial use, so how much and how well we're using them, and it puts together with resistance in human health. And that report aims to raise awareness in the trends of antimicrobial resistance in both the hospital and the community setting. It outlines priorities for control and prevention in AMR. And again, it connects it by promoting improvement for antimicrobial use. There are some key messages in the AURA report. But firstly, that antimicrobial resistance continues to be one of the greatest threats to human, animal health and food safety. So that's that One Health model that a lot of you will have already heard about. So it's not just about humans, it's not just about animal health, it's about how we're using them, where they go into food, the pharmaceutical companies, how the impact on the environment. And the other thing that the AURA report tells us is that antimicrobials continue to be prescribed in Australia at much higher rates than most European countries and Canada. So what is that telling us? Countries that are very similar to Australia, that have very similar infections, we're using way more antibiotics. So we've got a long way to go to meet places like Canada and Sweden and Norway. The other thing that's really important is 40%, so that's almost half of Australia's population, have had at least one antimicrobial dispensed. And the 2019 data is because it takes time for data to get into reports and for them to be published. So the AURA 2021 reports 2019 data. The other important key message from the AURA report is that antimicrobials have increased in hospitals, and there has been no improvement in overall appropriateness of prescribing. So we've got a lot of work to do to get those key messages out there and to find different ways to get the hospitals to use antimicrobials better. The other really important thing is more than 80% of people with non-complex respiratory tract infections, people with bronchitis, people with sinusitis, non-infective COPD, those upper respiratory tract infections are most likely to be viral, 80% of people. So we do have a long way to go with that. The other thing that I wanted to talk about, which I touched briefly at the start of the talk, is the Antimicrobial Stewardship in Australia Healthcare, the AMS book. And this book is quite an extensive volume, and it's used widely in Australian hospitals and primary care, nursing homes, and in lots of different settings, because it provides evidence and information that informs antimicrobial stewardship strategies, gives us those interventions, and it helps us implement them across a range of settings. And they're put into chapters for a reason. So we have chapter 1 to 7, and they are strategies for implementing and sustaining an AMS program. So anybody who reads this book, it's step by step. How do we get those strategies? How do we implement them into our setting? Chapters 8 to 12 examine the roles of different clinicians. It allows us to target our doctors, target our nurses, target our pharmacists. And now we're starting to put chapters 13 and beyond. We're considering AMS in settings such as general practice, which is what we're talking about today, that primary care setting. But it also looks at children, paediatrics, Aboriginal and Torres Strait Islander people, and looking at our aged care. This slide shows you that the AMS book is constantly being added to, and just recently through Antimicrobial Awareness Week, we've just published the latest chapter, chapter 17, which addresses antimicrobial stewardship in rural and remote hospitals and health services. But we haven't just stopped there. We're looking at other areas such as private hospitals, dental practice, and we're going to keep on putting publications and adding to this book so that it's a wealth of knowledge for all kinds of settings. So the other thing I wanted to talk about is the Antimicrobial Stewardship Clinical Care Standards Monitoring Tool. It's a tool for local health service to use and monitor the implementation and quality of statements. So that means once you've had that AMS book and you've implemented your AMS program, how do you monitor it? It gives support to local clinical quality improvement activities. So that means that we're not just seeing what we're using, we're now putting that into practice and getting some of those quality improvement processes happening. And it allows that constant monitoring, implementation, and evaluation of quality statements. But the Commission does not make these mandatory or set benchmarks. What this monitoring tool does is it uses evidence from publications like the AURA report to make a set of quality statements or implementation strategies and then provide them in a range of healthcare services so that the healthcare service can mandate or set benchmarks that fit their local situation. Because what we know is that one set of benchmarks in one setting, such as rural or less resourced areas, is not the same as another setting, such as those in well-resourced areas that are able to meet all of the indicators at 100%. So I'd like to touch briefly on the Preventing and Controlling Infection Standard that is produced by the Commission. It has been updated recently and takes into account recent events such as the COVID response. However, the objectives of the previous standard remains the same. These objectives are to reduce the risks of infection, effectively manage infections that present, and prevent and contain antimicrobial resistance, promote appropriate prescribing and infection and prevention measures. The new standards will come into action at the start of January as part of the Australian Healthcare Accreditation System. And not only does it provide actions and provide actions from the AMS clinical care standards that I just talked about, but it asks healthcare providers to achieve those quality improvements, especially since we're not seeing any advancements inappropriate in the hospital setting that I just talked about. I'd also touch on some of the other resources that support primary care, such as the therapeutic guidelines. We partner with the Commission to harmonise care in Australia so that you can see and provide advice to general practitioners in situations where antimicrobials are not appropriate. And you can see in the top three, these are upper respiratory tract infections. They're symptomatic treatment for most cases where antimicrobials don't need to be used. So just to finish off, I wanted to talk about how we're using antimicrobials in the community and why it's a priority area for action. We know that community use of antimicrobials is that priority area. AMS is well established in hospital settings and becoming established in the aged care setting. However, it is only developing in the primary care setting in Australia. What we saw in Australia through the AURA report was a decrease in prescribing of antimicrobials in the community during COVID. But the real question is around appropriateness. So consumption doesn't tell us how appropriate those antimicrobials are being used. And what we would like to see is more data on this so that we can understand the scope of the problem. All of the resources that I have discussed in this talk is freely available. Many of the resources are adaptable to different settings, and when they are used together, they should provide data for action that can help use antimicrobials more appropriately in primary care and reduce the spread of antimicrobial resistance in the community. And I'd just like to finish my presentation there. Well, thank you for listening.
Thank you very much, Lisa. Now we've got just a little bit of time for some questions, and there are some questions in the Q&A already. And we do have a poll we'd like to put to as well, because we want to choose one of these case studies to take to the global event next week. So we need your feedback there. But just to go to a couple of the questions, I know there was one on health literacy. Maybe I can put that to each of the panelists very quickly because we're running very much out of time. So how important is health literacy in terms of meeting the antimicrobial resistance guidelines or protocols? Maybe all of our panelists can come on board now, open up their cameras and their microphones. So Lisa, Leonie, Fiona, and Judith, if you can all have your cameras open. So
I might start just to get the ball rolling. So I think obviously health literacy is important, but what's interesting about antimicrobial use is that sometimes our clinicians and our patients might have all the information, but it's their attitudes, cultural beliefs, or their behaviours that we also need to change. And so that takes time and effort, but understanding the reason behind why does that mother want an antibiotic for her child from the general practitioner or the local doctor? She might theoretically know that it's a virus, it doesn't need bacteria, but might have some personal concerns. So yes, health literacy is a piece, but I think that also in fighting antimicrobial resistance, we also need to consider attitudes and behaviours as well.
And I agree with Fiona. I think she's made a really good point, is that if we just look at health literacy, we're not getting through to the consumers. And when we're talking about primary healthcare, it's not just the doctors or the health professionals. We really need to get through to the community. And you can't ask the community to have that great health literacy. We've got to be pitching our message to our consumers so that we reach them, because antimicrobial resistance is in the community as well. And we really want to make sure that our consumers are helping with the fight for antimicrobial resistance.
Lisa, there's a question specifically for you, but I'm going to have a lash at answering this as well. But in the guidelines developed and used for respiratory conditions, are there specific examples of evidence-based symptomatic relief that might be provided instead of going for an antibiotic? Is there, as a guide to the most appropriate choices?
That's a great question. There is, I don't have any at hand, but there have been a lot of really good information around some of the upper respiratory tract infections and not using antimicrobial straight away. Obviously, if you've got a lower respiratory tract infection and you're talking about pneumonia or something like that, even if it's viral, your doctors are not going to not want to use an antibiotic. The problem with pneumonias is that you can get secondary bacterial infections. Things can go very quickly. But when we're talking about upper respiratory tract infections, we're not talking about somebody who's in hospital. We're talking about somebody who's gone to the GP, who has time, who you can put off giving that antibiotic prescription for. But as for, is there evidence? There is evidence in the literature. There's a good body of evidence that is available. I'm sure we could send some around to give you that evidence, but it's definitely, if we can get that message out there and support like the therapeutic guidelines poster that I put up before, so that when the mums come to the general practitioner and they really want an antibiotic because they've got a sick child, and when you've got a sick child you really want to look after them. It's how do we get that message to say, yes, you can give symptomatic treatment and your child will get better just as well if we don't give them antibiotics.
I think what the question is asking, and this is what I would say as well, yeah. The therapeutic guidelines that you put up there, and these are the Australian therapeutic guidelines, of course, but there are similar guidelines around the world, say symptomatic treatment is the first choice. But there are very few examples of what those symptomatic treatments should be. Now, I'm going to get a plug in here for the Global Respiratory Infection Partnership, because there are examples there and those resources are available. It's just come up on the chat screen there, www.grip-initiative.org. Fantastic resources and good options for all of us, wherever we are in the Western Pacific region and indeed the world, to recommend as pharmacists. I don't think the doctors know enough about symptomatic treatments, but we do, we should, and we should have those examples available. I guess what I would say, Leonie, particularly to you, first of all, you've got guidelines for compliance, but how compliant are the prescribers in only prescribing antibiotics when they're necessary? You mentioned, I think, in your presentation that you're asking all of the pharmacists and the doctors to comply. Are they compliant?
Okay. Thank you, John, for that. Well, as in any other thing that you would start to do, it really is difficult to see very good compliance for a certain directive or guideline that you set. But I am also proud to say that at the hospital level, we have a number already who complies with what the standards of treatment is set in that particular institution. Now, the problem that we are experiencing actually is the use of this antimicrobial at the community level. Because while pharmacies, for example, are complying on the dispensing guideline requirement, the antimicrobials are still available in agricultural stores, agricultural product stores. They are not as strictly monitored as the strict monitoring is done to pharmacy. And this is something that we are trying to really work on, because while there is an interagency committee being organized as directed by the Office of the President, we still find in the ground some who do not comply with what are set. So what I would say, compliance definitely is really a problem, but that is not impossible. We are looking at it on a little by little happening. And that's the reason why even on the patient level, we are massively working on educating them, because if the patient starts to ask, if you're conscious and given this particular antimicrobial and you start asking and you know what it could have as an effect on you, then maybe it's just as simple as saying, if no taper, then maybe we could minimize the abuse and irrational use.
Thanks. Thank you. Thanks, Leonie. And we've got to wrap up in a minute or so. I've been given a couple of extra minutes, which we will need. But I know that, Judith, you mentioned about the importance of education. I was going to ask you who does the educating, but I'm going to answer it now. It's us. It's we pharmacists who have to educate. We have to educate the doctors and other pharmacists, and particularly the community, our patients, as to why very often antibiotics are not needed. Sometimes they're very counterproductive, and often symptomatic treatment is much more preferable. Now, what we need to do is go to a poll because we want to identify, please, in your minds, all of you people listening and looking, which of these initiatives are you most likely to implement in your country? That's the first question. Which of these initiatives are you most likely to implement in your country? Just think back what we've heard over the last 45 minutes or so. Which of those initiatives are you most likely to implement? And you must vote now. So submit your vote now. Is it case study 1, case study 2, or case study 3? you can vote in the in the poll there. So it looks as though case study 1 just comes out in front, has at least half of the votes there. Now we're going to go on to the next question. The next question is, which initiative could be implemented the quickest, the most quickly in your country? Again, vote 1, 2 or 3. Case study 1, 2 or 3. Which initiative could you implement most quickly in your country? And we need you to vote now. Remember, we're going to take one of these case studies onto the global event next week, next Tuesday, and we want as many people as possible to come to that meeting. It'll be on Tuesday, November 30 at 11 a.m. Central European time. You can work out where you are in the world in your time zone. So the voting now, again, case study 1 has come up with the greatest number. And finally, the last question, which initiative do you think would have the biggest impact in your country? Remember, we're looking at impact throughout the healthcare system, in hospitals, in community. How do you think, or which of those initiatives do you think might have the biggest impact in your country? So we need you to vote now. And I think we've just about got those votes coming through now. Maybe I can preempt, it will be in fact case study 1 again. Well, thank you so much for those results. It means that we're going to take case study 1 to that meeting next week, next Tuesday. It's Tuesday, November 30, so just a week away, or less than a week away, 11 a.m. Central European time. Please log in. I should remind you that the FIP Commission on antimicrobial resistance, set up by the Bureau, the FIP Bureau last year, will monitor the progress of AMS annually throughout the various regions. And we want to be stimulating the global community of pharmacists to be more active as agents in minimising AMR. So that's the meeting next week. Please come along, register for that event if you haven't already signed up for it. We thank the FIP worldwide, particularly the AMR Commission. We thank very much Reckitt for being our industry partner and sponsoring this whole program. We're very much indebted to Reckitt for doing that. And I give a shout out to the Global Respiratory Infection Partnership. You've got the website there, at www.grip-initiative.org. Please have a look at that. I want to thank personally all of the panelists, Judith, Lisa, and Leonie, of course, and as well, you did a double job here, Leonie. Fiona, thank you so much also for you. So that's it. I'll be winding up. Thank you so much for all those who logged in and listened and looked tonight. Send the message around. Tell all your friends and relatives, everyone you can get to come along next Tuesday, the 30th. We'll see you then, I hope. Thank you so much.
Thank you.
Thank you, John, for your
much.
moderation. Thank you, John.
Yeah, thank you.
Thank you, John. Thank you, everyone. Thank you, Fiona, Lisa, and Judith, and everyone.
You did great presentations. I really enjoyed listening. Thank you.
Thank
you all.
Thank you, Lisa.